Hello, I'm Dr. Jody Van Tine. Today I am going to present to you a cat that I treated integratively for feline cystitis and lower urinary tract disease. This is Sil. His name is XL, pronounced Sil Van Imber. At the time in 2010, he was 7 years old, and he was a male neutered domestic medium hair, actually, cat. And he presented to his regular veterinarian for potential urethral obstruction. He'd been straining to urinate, noticed blood in the urine, and potentially had a bit of an upper respiratory infection. Their exam at that time showed that he had a 1 to 2 soft heart murmur. Previously, his urinalysis in December was normal. The urine concentration was, on the high side, but normal for a cat eating dry food. pH was 6.5, and then in January of 2010, he became unable to urinate. He was treated conventionally with probanthine and phenoxybenzamine to prevent him from blocking and facilitate urination, diazepam, and the marbofloxacin was for the presumptive upper respiratory infection. His urine pH was pretty dilute, pH was okay, and then in March when they did the follow-up, his urine specific gravity was back up to being very concentrated. The pH had dropped a little bit, and they continued those same medications. And then when they rechecked him again in April, his urinalysis, the specific gravity and pH were the same, but now there was a significant amount of hematuria with some protein, and one of his liver enzymes, the GGT, was elevated at 13, and there's the normal range to the right there. So at that time, they continued the probanthine and the phenoxybenzamine, added ammonil, which is methionine, denamarin for the liver, and he was due for his feline leukemia vaccination, so they gave that to him as well. In May, the owner came to me and asked if there was anything else that she could do to treat him, and wanted to treat him integratively with herbs and food therapy. So at that time, Sil's Western diagnosis was feline lower urinary tract disease, and he seemed to be at risk for urethral obstruction. His Eastern diagnosis was Lin Zheng, which is urinary disorder, specifically Ray Lin, which is heat dysuria with frequent painful burning urination or damp heat in the lower jiao, and Shilin, which is difficult and painful urination with possible sudden termination of urine flow. He didn't have any crystals in his urine, really no significant epithelial cells, so I wasn't really sure that he was necessarily at risk for blocking, but the Shilin seemed to fit that it was painful and that the urination terminated suddenly. So let me review Lin Zheng, which is dysuria syndrome. For you, Gao Lin is cloudy dysuria. It's where you see urine that's milky, and it's the bladder's inability to separate the turbid from the pure. Lao Lin is fatigue dysuria. I think of that as urinary incontinence or urine leaking or abnormal urination after exercise or physical exertion from a qi deficiency. Qilin is more of an obstruction, an obstructed urinary flow, so that would be being blocked, lower abdominal distension and pain. Raylin is heat dysuria, so hematuria. Shilin is stone dysuria, crystalluria, or urolithiasis. Raylin is damp heat dysuria, so it's kind of a combination of the heat congealing the chronic dampness, which creates phlegm, which is the description, the Chinese description for stones and crystals. So it's kind of more of the stone dysuria is the chronic process, and Shi Lin is a combination of that. And Shui Lin is bloody dysuria, blood in the urine, hematuria, blood clots, those types of things. So again, in his history and his exam, his diet is dry kibble with some canned food. He lives indoors only, shares a home with another cat, Timbuki, that he gets along with very well. His current medications were ammonil and denamarin. I did not appreciate a heart murmur on my exam. His tongue had swollen sides with a lavender center, a little bit of a slight yellow coating, and the pulse was thin and rapid. He had a little bit of gingivitis. His bladder was not distended or painful at all. It was small. To me, felt fairly normal. So my TCM diagnosis was a spleen Qi deficiency from the dry kibble and the damp heat in the lower jiao with the history of the hematuria and the cystitis. Stagnation with the straining, stagnation, maybe Qi stagnation with the lavender center to the tongue. With stagnation and the lower jiao, I'm always going to put liver on my list. It's lower on my list than the spleen Qi deficiency and the damp heat in the lower jiao, but the liver can be involved in syndromes and problems in the lower jiao as well. So I put that on my list, although it was lower. And my treatment plan at that point was to tonify the spleen and clear damp heat. The spleen is the source of all the damp in the body. And so I wanted to address the root problem since his urinalysis didn't really show any heat and he wasn't clinically active for straining and inflammation. So to tonify the spleen, diminish damp and damp heat, my first thing was to modify the diet. Cats are obligate carnivores, and in a cat that's eating any kind of a dry kibble, I'll usually at least try to switch them onto canned food. The owner, if she needed to feed dry, was going to feed origin kibble. We didn't discuss raw cat food at the time. We eventually got there, but usually with cats, I try to gradually change them. If they'll eat canned food, I switch them onto canned food, and then I'll gradually start mixing in the raw with the canned to try to replace it. I don't have a lot of success switching cats from dry kibble just straight to raw. So, and in 2010, there weren't as many options for raw cat food also as there are now. So that was our dietary plan. We discontinued the Ammonil. The pH was 6.5. I didn't see a reason really that it was really doing anything. Discontinued the diazepam because of the elevation in the GGT, but we continued the Denamarin for that same reason. And 2 herbal formulas were chosen. The first is Wu Ling San, which was a modification by Golden Flower Herbs at a dose of 600 milligrams once a day in the morning, and Sum Yao San, or 4 Marvel, 600 milligrams once a day in the evening. And then to the canned food, we added a little bit of probiotic. The microbiome is very important in maintaining the health of the intestinal, small bowel microvilli, which is the spleen Qi, the digestive function. And so we added a little bit of a probiotic. Wu Ling San, or Poria 5, has an action to strengthen the spleen. It drains damp, it promotes urination, so it drains damp down and out through the bladder, warms the yang, and disperses water accumulations to treat edema. I think of it as a herbal furosemide in that sense as far as treating edema. Its indications for urinary tract disease are for urinary tract infections, difficult and retained urinations, and urolithiasis. Tongue, typically for this formula, you'll see it as swollen and wet. The pulses are usually slippery, but they can be superficial and rapid. The composition of Wu Ling San is a combination of 5 herbs, hence the name Poria 5. And you'll have to excuse my Chinese medicine pronunciations. They aren't the best, but I try. Zhu Shai is alisma, which is the Asian water plantain. Fu Ling is Poria. Zhu Ling is polyporus. Bai Zhu is white Atractylodes rhizome, and Guizi is cinnamon. So the way these herbs work in combination, the alisma, or the Zhi Shai, induces urination to remove the water accumulations. The Zhu Ling and Fu Ling strengthen the spleen to resolve damp and cooperate with the alisma to remove water accumulation. The Bai Zhu Atractylodes strengthens and dries the spleen and dispels damp. So you can see here there's a lot of damp draining, removing water accumulation actions to these first 4 herbs. The Guizi, or the cinnamon, activates the damp draining action of the other herbs. It warms the yang of the middle and lower burners and relieves Tai Yang syndrome to strengthen the function of the urinary bladder. It is a formula that is used for the Tai Yang exterior syndrome when there is a pathogen invasion of the Tai Yang channel. That pathogen can travel down the Tai Yang channel to invade the bladder. This cat had an upper respiratory infection, and I wanted to make sure that we didn't allow any pathogen to go any further, any deeper. And so this formula is a good choice to help prevent that pathogen from progressing. The pharmacological actions of Wuling San, it's been shown to protect the kidneys in models of nephritis and fibrosis of the glomeruli in a mouse model of diabetic nephropathy. It has diuretic effects via inhibition of the renin-angiotensin-aldosterone system. Again, I think of it kind of like herbal furosemide. So one study showed increased urine output with no significant change in pH, electrolyte, renal, or liver values. I did see another study that had a comment about checking electrolytes and concerns for the potassium. So if this formula is something that I use long-term, for example, maybe heart disease, I will monitor the serum chemistry and electrolytes periodically. Wuling San also was shown in an alcohol-induced hepatitis model in mice to have a hepatoprotective effect. So that is useful here, especially with the elevation in the GGT and SIL. The second formula that I used was the 4-Marvel formula, or Sumyao San. Sumyao San is one of the most commonly used formulas. It tonifies the spleen, dries damp, and clears heat. It's a fairly damp heat clearing formula with some spleen tonification properties. It removes damp heat obstruction in the lower jiao. This formula is also used for in the lower jiao and the hind end for numbness and weakness in the lower limbs and inflammation in the joints, urinary tract infection, painful hematuria, and the tongue is typically appears to be swollen, wet, possibly with a greasy yellow coating, and the pulse is commonly rapid and slippery from the heat and the damp, respectively. Sumyao San contains 4 herbs. Huang Bai, I put Bo here. The formulary with the 4 Marvels description said Huang Bo, but the herb that the Western name was philodendron, which is Huang Bai. So I just wanted to include both, but it is philodendron or Huang Bai in the traditional Sumyao San formula. Yi Ren, which is koi or barley, Kong Zhu, Atractylodes, and Xuan Niu Shi, Cyathala root. The golden flower version of Sumyao San substitutes Xuan Niu Shi for Niu Shi. So I put that here, and I'll visit it in a little bit as well. When you pick a formula, you want to make sure that you look at the herbs in the formula, because a lot of companies will modify and tweak the herbal formulas just a little bit to give it a little bit different action. And so if that's something that's important in the case that you're treating, you want to really make sure that you know if it's the traditional formula or a modification of the formula, what the changes are and are they appropriate to your case. So Huang Bai, philodendron, clears heat and dries damp in the lower jiao. The Kongzhu strengthens the spleen and dries damp, and together they combine to form a classic formula called 2 Marvels formula. The addition of Yi Ren strengthens the spleen to resolve damp, has some pain relieving properties, and clears heat, and it supports Huang Bai and Kongzhu, the 2 Marvels, by draining damp and supporting the spleen. So it kind of augments the spleen tonifying, damp draining properties of the first 2 herbs. Now, I mentioned that this was a modification of the traditional formula. The traditional formula uses Niu Shi with Yi Ren, which tonifies the liver and kidney and dries damp. This formula is used more to treat pain disorders of the lower body with lower back, knee weakness, and deficiency. It also has an astringing action to help prevent loss of yin due to the drying effects of Huang Bai and Kongzhu, and make that a little bit safer for long-term use. Okay, so the modification that I used substituted Xuan Niu Shi, and that herb guides the formula to the lower half of the body, activates blood, so it'll help relieve blood stasis pain. It promotes urination and also tonifies the liver and the kidney. It's good for treating pain characterized by blood stasis, by its blood activating properties, and disorders caused by excess heat. So that modification makes it a little bit more specific, perhaps for a cystitis. The pharmacological actions of Sumyasan, I'm just really going to talk about one. There's many. Huang Bai or philodendron has been shown to contain several alkaloids. One of them, if perhaps not the most significant, is berberine, which has anti-inflammatory and antimicrobial effects. Philodendron or Huang Bai extract that contained berberine was suggested to induce its anti-inflammatory effects by inhibiting inducible nitric oxide synthetase and reducing nitric oxide accumulation. It lessened edema also in another study by reducing the activity of myeloperoxidase and the content of reactive oxygen species or free oxygen radicals. Both nitric oxide and free oxygen radicals run rampant in inflammation, and so by reducing the nitric oxide and the free oxygen radicals, you can decrease inflammation. It also had some antimicrobial effects, which were in part reducing bacterial adhesion of Staph aureus and intracellular invasion of gingival fibroblasts in an in vitro study, and also was shown to lessen antibiotic resistance, specifically to aminoglycosides by Pseudomonas aeruginosa. So first summary of results. In April, the urine was fairly concentrated with 3+ blood and 1+ protein with an elevated GGT. We started treating with Fuling San and Sumyasan in May, and then when we rechecked the urinalysis on an outpatient basis in June, the urine specific gravity was improved. It was lower. It was at 1035. There was still the same amount of blood that wasn't changed, but there was no longer any proteinuria, and the GGT had decreased from 13 down to 1, which was within the normal range of 0 to 6 there. So at that time, we continued the diet change, but we continued to increase the ratio of canned to dry, preferably no dry. We continued the Fuling San at 600 milligrams once a day in the morning, and substituted a formula. Again, it was a golden flower formula, polyporous and dianthus, at 600 milligrams by mouth twice a day. We discontinued the 4 marvels too, just so that's clear. So the polyporous and dianthus formula is a modification of Zhuling Tong, and it works to disinhibit urine, leaches damp, drains heat from the urinary tract, and also has some yin protecting actions in the lower jiao. It's indicated, as you can see here, for a variety of lower urinary tract and urinary tract diseases, inflammation, acute and chronic, blood in the urine, painful or difficult urination, urolithiasis, crystals, stones, or retention or suppression, difficult urination. The tongue with this formula is typically dark red and dry. It may have a yellow coating, and the pulse is superficial and rapid. And again, I don't have the notes from 2010 for the TCM exam, but I did have the urinalysis, and this was the formula that we substituted for the Sumyasan. The composition of this formula is Fuling, Zhuling, and Zhushi, which are 3 of the herbs in the traditional formula Zhuling Tong. The herbs in Zhuling Tong are listed here at the bottom. Zhuling, polyporous, poria, Fuling, and Zhushi, alisma, are 3 of the herbs that are retained. Hua Shi and Yi Jiao is talc and asshide gelatin were replaced with these 6 other herbs: Loparathum, Chu Mai dianthus, Jimu anemorenae, Xuan Xinlian, which is Andrographis. Huangbai is an herb that's in common with the Sumyaosan, so that was actually retained. And Shu Wei, which is Perosia leaf. So the Zhuling Tong treats accumulation of damp with interior heat. If you remember, the Fuling Tong prevents exterior heat from invading the bladder channel. This treats the accumulation of damp when there's interior heat, and it's nourishing the yin without entrapment of heat pathogens. So we initially used a formula that would prevent any continued pathogen invasion, exterior pathogen invasion in the Taiyang channel. And then we added a formula that nourishes yin that would not entrap any heat pathogens, kind of a just in case. It clears heat, stops bleeding. The Dan Zhuye clears heat in the heart and small intestine. When there is inflammation in the small intestine, that can affect the bladder's ability to separate the clear from the turbid. Excuse me. And that's how the heat in the small intestine can cause dysuria and painful urination. Chumai promotes diuresis to treat Reilin, Shuilin, and Shilin, which we've already described. The Jimu nourishes yin to moisten dryness and clear deficiency heat. It generates fluids to protect the yin. So originally, the Sumyaosan is a damp and heat clearing formula. It's very cold and dry. And so we've replaced that with a formula that will prevent entrapment of heat pathogens. There is still some heat clearing properties to this formula, but it also has some yin tonifying properties and nourishing properties to astringe the yin a little bit more and to protect from yin depletion. Xuan Xin Lian, or Andrographis, is a really useful formula, especially I've seen it a lot in formulas for colds and flus and upper respiratory infections. It clears heat and eliminates toxins and dries damp. It has antibiotic effects, anti-inflammatory effects. It also has some hepatoprotective effect and is useful for the urinary tract for dysuria and Reilin. Shu Wei promotes diuresis for Ling-Zhen syndromes, stops bleeding. It specifically enters the urinary bladder channel and is useful for edema, in combination with Zhe and Fuling. So there still is damp draining and heat clearing properties. This formula does not have any spleen qi tonifying properties, but focuses the heat and damp clearing onto the urinary bladder and the lower urinary tract. So just a summary here, and I apologize for my picture cutting off some of the words here on the bottom, but I just wanted to compare the formulas. So we started with the Wuling San, which has herbs in it that tonify the spleen, strengthen the spleen to resolve damp. It drains damp down and out and induces urination in that way. The Guizi releases the exterior, promotes the flow of yang qi in the interior, which, as I said, prevents the internalization or progression of external heat pathogens into the Taiyang layer to strengthen the function of the urinary bladder. And to that, we originally combined it with Four Marvels Sumyaosan, which clears heat and dries damp in the lower jiao. It does have also some spleen qi tonifying properties, damp draining, and is a fairly good heat clearing, anti-inflammatory formula with antimicrobial properties as well. And then the modification that I used, Xuan Niu Shi, guides the formula to the lower half of the body to activate blood, promoting urination, and also has a little bit of liver and kidney tonifying property. Then we replaced the Sumyaosan with the polyporous and dianthus, which retains some of the spleen qi tonifying properties and damp draining properties of the Fuling. We might even have been able to discontinue the Wuling San as well, since 3 of the 5 herbs that are in Wuling San are also contained in the polyporous and dianthus. It contains Huangbai also, so it has the continuation of the berberine composition and the anti-inflammatory, antimicrobial, damp and heat clearing and draining property of the philodendron. But instead, it has, and I apologize for that, it has those additional herbs that guide the formula specifically for Reylin, Shilin, and focuses it on the bladder and the bladder inflammation. The pharmacologic actions that are included in some of the herbs in Polyporus and Dianthus, the andrographis has been shown to inhibit superoxide free radicals and nitric oxide. That's the anti-inflammatory property. And it also, interestingly, inhibits carrageenan-induced inflammation. I mentioned before that the small intestine and the heart and small intestine can have an influence on the bladder's ability to clear the turbid and separate the clear from the turbid. Interestingly, carrageenan can be one of the contributing factors to inflammatory bowel disease, perhaps leaky gut syndrome and intestinal lining inflammation, especially in the cat, and that's going to cause enteritis. And I thought that it was interesting here that the andrographis can inhibit carrageenan-induced inflammation. And so for me, that was one way that I could connect the small intestine inflammation that carrageenan can cause, potentially with maybe carrageenan has a role in cystitis directly, or long-term damp heat and chronic inflammation in the intestine can cause systemic inflammation, which can certainly cause accumulation of intestinal and renal inflammation as nephritis and enteritis. So they can definitely all be connected. The Chumai dianthus in this formula does have a nephroprotective effect. It's been shown to decrease renal fibrosis and inflammation, and also decrease albumin excretion. So it can help with proteinuria as well, and the function of the glomeruli. It affects its anti-inflammatory effects by downregulating inducible nitric oxide synthetase. Shu Wei, another herb, was shown to have a significant positive effect on lower urinary tract in TCM patients. They did a study in people with a Shu Wei tablet, and the patients that received this formula had less long-term inflammation and had better treatment of their acute cystitis than the patients who did not get this herb. So I just wanted to put this here. This is a summary of what we did over time. Again, in December 2009, everything as far as urine goes really looked pretty good. In January, it looked pretty good. And then in March, the urine looked pretty good. I'm sorry, in January, the urine looked good, but even though there was no blood or protein in the urine, he was straining and he was really uncomfortable. So he was treated with the Western medications, probanthine, phenoxybenzamine, diazepam, and again, marbofloxacin for presumptive upper respiratory infection. In March, 3 months later, follow-up, urinalysis showed that the urine concentration was back up to normal. pH had dropped a little bit, still really no blood or protein, but his clinical signs had resolved. He was doing well, and everything looked pretty good. In April, when he went back for just a routine follow-up, he was not clinically symptomatic for lower urinary tract disease, but he was beginning to show signs of hematuria and proteinuria in his urinalysis. And also importantly, the GGT had risen from 8, which was just outside the normal range of 0 to 6, up to 13. So at that time, they added ammonil, they added denamarin for the elevation in the GGT, and vaccinated him. In between April and June was when I started seeing Syl for integrative treatment, when what we did, because he wasn't straining or showing any dysuria, we discontinued the probanthine, the phenoxybenzamine, the diazepam, and the ammonil. And really all we did was continue the Denamarin for the GGT and added the 2 herbal formulas to help with diuresis and to tonify the spleen and to help resolve any damp heat. When we followed up with urinalysis and the blood work a month later, the urine concentration had decreased a bit, so it was much closer to where I like to see it. I like to see it 1025 to 1030, certainly much better than 1050 or 1055. pH was pretty stable. There was a resolution of the proteinuria, but really no significant change in the hematuria. It was still 3+. But the thing I was really pleased to see was the GGT was back down to the low end of normal at 1. And at that point, I substituted the polyporous and dianthus for the sumyasan for the actions and the reasons that I just got through discussing. 3 months later, at a recheck, the blood was gone, the hematuria was resolved, the GGT was still normal. I've seen this cat for a while, and so he's had some issues with his white blood cells and his thyroid hormone level over time as he's aged. So I just put these in to show that the white blood cells and the thyroid levels are not a significant factor at this point in his life. The specific gravity a year later, a year after I started treating him, was pretty dilute at 1020. The pH in the urine was up a little bit of protein in the urine, and the AST was up significantly. So we modified the herbal formulas and to a different formula. Actually, it was Wei Ling Tong to address that a little bit more directly, but that is another discussion for another day, because the point of this was just to really show you an example of integrative therapy for dysuria, cystitis, hematuria, using integrative therapy. So there was a study, it was a review that I found that showed that human women with urinary tract infections, acute or chronic, actually had a better outcome retrospectively than when they were treated with Chinese herbal formulas as compared to Western medicine alone. One formula in particular was Xian Tong, which is 2 Immortals decoction. It regulates the Ren and Chong vessels, replenishes kidney yin and yang, tonifies the prenatal essence, and drains deficiency fire from the kidney that can rise up to disturb the heart. I could have considered this formula at the time. I've not been doing herbal medicine for very long. Retrospectively, it's easy to see things that I could have done, but this would be something that you can come back in after you've cleared heat and drained damp and gotten rid of all of the excesses. When we were talking through the herbal formulas, the polyporous and dianthus formula had a couple herbs in it that nourished yin and replaced yin to prevent dryness from continued draining and clearing and heat clearing and that. And so one of the things that's important and that I like about using Chinese medicine is once you've taken care of the excesses and the immediate problem, you can come back in and provide building blocks and yin and nutritional supplements and things to help restore normal and to help restore homeostasis and to help replace the things that have been used up in trying to clear that chronic inflammation or an infection or a pathogen or something like that. And so that was something that I just found interesting that I wanted to use to make that point. Once the infection in the hematuria has been resolved, there's absolutely nothing wrong in coming back with more of a tonifying, nourishing formula and following up just to kind of rebuild. So the point also that I wanted to make with this is that it drains deficiency fire from the kidney that rises up to disturb the heart. So if you're clearing heat and drying and draining and clearing, and you diminish kidney yin, kidney jing, potentially jing resides in yin, and you have a kidney yin deficiency from all of that, you can have what's called a deficiency fire. So I think of it as my air conditioner is not working. So it's really hot outside, but I don't have any cool air or ice cubes or water to drink. And so I just get dry and I just get hotter and hotter. And so it's not really a true excess heat like fever would be or an infection would be. But it's deficiency heat. It's heat or a yang excess relative to a yin deficiency. So this was just, I told you that I've treated SIL for a long time. And in that context, in the kidney and the heart fire flaring up, I just wanted to show you that over time, even though this case was from 10 years ago, over time, I like to look at the patterns of the diseases and to see maybe, you know, how things have progressed. How did we get from there to how we are today? He had a suspicion of hyperthyroidism at one point, had another bout of hematuria and some neutropenia and lymphopenia. But the interesting thing is he's gone on to develop some heart disease, which was occulted as a soft murmur originally. And most recently, his echocardiogram showed a right dynamic, right ventricular outflow obstruction, mild hypertrophy of the left ventricular papillary muscles, thinning of the interventricular septum, and slightly dilated left ventricle. His diagnosis is a mild, slowly progressive, unclassified cardiomyopathy. Also, his kidney values are up a little bit. The SDMA is 17, the BUN is 45. Teeny bit of blood in the urine specific gravity is good. So he's starting to show a little bit of some chronic renal insufficiency, perhaps. And then also he has developed some heart disease as well. So in looking at it from a TCM perspective, the reason that I went to the spleen as the root cause of the damp and the damp heat isn't necessarily because I'm looking at the grandmother or the control cycle here, that the spleen is the grandparent of the kidney. But what I was looking at was the spleen and the kidney have this relationship here. So the kidney is your prenatal essence or your Jing, and it's basically your genetics. Your spleen is your postnatal essence. And so when you're born, you have your genetics, and you know, really kind of what you're born with, what you're going to look like, what breed you're going to be, what disease tendencies you might have, what size you're going to have, what color eyes you're going to have, and all of that. It also provides the fire under the cooking pot, which is the spleen. The way that you accumulate chi and acquire chi after you're born, your kidney essence is only going to last you for a short period of time. So you have to eat and you have to drink shortly after you're born, and that's your postnatal chi. And that postnatal chi will be used to go back and replenish stores of prenatal chi that you use up as you live, basically. So, you know, you're born with your maximum amount of kidney Jing and kidney Yin, and over time, you know, as you age and you become elderly, you become kidney Yin and kidney Jing deficient, which is why your hair grays and you get lower back pain and the changes associated with aging. The way that you can keep your bank account, so to speak, as full as possible is to maximize your spleen chi and to support that and keep it as healthy as possible. Okay, and so that was why I chose to start with the spleen as the root cause, because there was a lot of damp and there was a lot of heat. And I know that the spleen is the cause or the source of most of the damp, if not all of the damp in the body. Okay, so that I didn't use the 5-element controlling cycle for my original treatment plan. However, I thought it was interesting when we started going through the formulas and we used damp draining, heat clearing formulas, we started to see formulas that nourished yin, that were more astringing, that would hold yin in to preserve the body fluids so that you would not accelerate this decline in kidney yin. And again, your Jing resides in your yin. So if you are kidney yin deficient, the kidney is the controlling element for the heart. And if you have a kidney deficiency, you are going to lose control of the heart. And if you have a kidney yin deficiency with deficiency fire, then you have that fire going up, and that's going to potentially be a contributing factor, lack of control, to an excess of the heart, because the grandparent is failing to control the grandchild. So I just thought that that's, I like to go back and look at cases and see how I can relate them to where we started and how did it progress, and where are we at now. Not only because I think it's fascinating, but also because then when I see cases in the future, I can maybe target my therapy and do more maintenance and use things like the air Xian Tong to slow this down. I mean, right now, Sil is 17, and so he's lived a really good long life, probably because we've done the integrative therapy. But anyway, those were my points for this case. That is Sil. I hope that you enjoyed learning about Sil and meeting him as much as I have. I'll probably use him for future case reports, either acupuncture or herbal medicine. If you have any questions about this case presentation, I would love to hear your questions. Maybe we can post this on the Case Help forum, and we can have a discussion on the forum. If you have any questions, I would love to see you there. Also, I wanted to show you that at the end of this presentation, there are slides that have references for the herbal formulas that I talked about. If the references weren't noted on the slides, they will be listed at the end of this presentation. I hope you've enjoyed it. I've enjoyed sharing Sil with you, and I will see you next time, okay? Thanks. Take care.